Welcome to the Eye Institute. My name is Dr. Liz Insull. I'm a cataract and oculoplastic surgeon. It's a pleasure to have you here with us today. You have come in for assessment of cataract surgery. Cataract surgery is day-stay surgery, so that means that you come in and you go home the same day. If you have surgery with me, I have an anaesthetist who can give you something to make you feel nice and relaxed if you would like it, and they also will do a block for the eye so that you don't feel or see anything during the surgery. The surgery takes about 15 or 20 minutes, but you're usually here for a 3 or 4 hour period. You get checked in, your pupils are dilated, and we check your medications and things, and afterwards you get a cup of tea or coffee and a sandwich. When you go home, you have eye drops for a whole month. You have 2 sets of eye drops, and what they do is they calm inflammation down, and they work in slightly different ways, which is why there's 2 lots of them. We usually see you at around 1 week, just to check everything's going well, but you'll have our contact details, and if you needed to get in contact with us earlier, you will absolutely be able to do that. The surgery is a good surgery, and 96% of people get better vision. Once the cataract's out, it's out for good. However, the weak capsule that the new lens goes into sometimes can become foggy days, weeks, months, years or decades later, and if that happens, you come and see us and we can laser it. That's an in-clinic procedure, fairly straightforward from our point of view. There's always risks to surgery. Thankfully, serious risks are very, very rare, but 1 in 1,000 people can lose vision from bleeding, infection or detached retina. 1 in 200 people might need 2 operations to remove the cataract. And 1 in 50, the operation might be tricky, take longer than half an hour, and take longer for the vision to come right. And I'll let you know during our consultation if that you have any particular risk factors for this. So take the cataract out, and then we put a new lens implant into the eye. And you get to decide where you want your focus to be. The standard lenses are monofocal lenses, and they're the ones that are paid for by the insurance company, and are also the ones that are paid for by the public health system. They give you really good vision in one plane, so they give good distance vision, but then you can't see anything up close. Okay, so for computers and for reading, you would need glasses, which you can get either from your optometrist or from the chemist, or the $2 shop can also work as well for readers. When you're seen as a private patient, you have more options for lenses. So the premium lenses we do a lot of here at Eye Institute, and there are 2 main types. There are the extended depth of focus lenses, or EDOF lenses, and they give you good distance vision all the way up to 1 meter, which we call intermediate vision. And that intermediate vision is useful for things like computers, dashboards in cars, walking, seeing the ground, which is useful as we all mature, and also for groceries. When you're out at the supermarket, you can see things on the shelf, which is very useful. It doesn't give you up close vision, so again, reading glasses, usually 1.5s from your optometrist or the chemist, help you with that up close reading, particularly in low light. So in the morning if you're reading the paper, or at night if you're reading a novel, you'll find that the reading glasses can be helpful. But what it does is it reduces reliance on glasses, probably by about 90%, so that's really helpful. And in some cases, once we get one eye perfect for distance, sometimes we can then focus the other eye slightly closer, which gives you a bit more range, and I'll talk about that with you in more detail as well. And the 3rd type of lens is the trifocal lens, or the multifocal lens, and that gives you distance, intermediate and near vision in each eye. And the way it does that is through using little circles like this. The light is divided into the different circles, which sometimes can mean contrast is not quite so clear, and then some people, they notice glare and halos, particularly if there's a lot of driving at night. So sometimes those lenses are very good in the non-dominant eye, and again, it really depends on the person and what your needs are for your vision and how you feel about glasses. So I will see you shortly, and we can discuss those options in more detail. Thanks.